Hi guys, thanks for tuning in. This is David Ritchie with Ritchie Limb and Brace here in New Braunfels, Texas. Today I want to talk to you about residual limb volume changes or atrophy. As a patient that wears a prosthesis, frequently throughout the day your residual limb's going to change volume, meaning that it's going to get smaller. And when that happens, the socket will get loose. The danger in not having a properly fitted socket is that your limb can actually fall into the socket and the distal tibia can start to have pressure right here, and that can actually cause a wound or a skin breakdown. It'll keep you out of your prosthesis and keep you from doing your daily activities. New amputees also go through a tremendous amount of volume change following their amputation. Initially, their amputation will be very large and swollen. We'll put shrinkers on that residual limb to manage it and get that volume down. Once they're fitted with their first socket, the whole distal section of the calf muscle is going to continue to get smaller and smaller as you move away from that date of surgery. How do you manage that? Well, you're going to use prosthetic socks. This is a prosthetic sock. Frequently, as your limb changes volume and it gets loose throughout the day, you would actually take the prosthesis off. You have a prosthetic sock that has a hole in it, and that hole is actually intended to slide over this liner so that the pin goes through. And essentially, when you put this on, that'll make your leg slightly larger and it fits down into the socket and it clicks right in. And that's how you will hold your prosthesis on with that pin lock system. These socks allow you to manage the volume of your limb throughout the day. Frequently, in patients that have transtibial amputations or below the knee actually changes at a slower rate than the distal section because you have all this soft tissue down here that's going to change quite a bit. So how do you manage that? Some of the strategies that we use here at Ritchie Limb and Brace in New Braunfels, Texas are, we'll have patients use a half sock. Well, what's a half sock? As simple as it sounds, it's taking a sock like this and cutting it right in half and just using the distal portion of the sock down here where you actually need it. So that can be snugger. If you were to put a full sock on, what would happen was it would fit okay down here, but then right around the knee it would be uncomfortably tight and you couldn't actually get seated fully within the socket. Some of the other strategies that I use when I see patients with a tremendous amount of volume changes. So as a case in point, earlier today I saw a patient who had lost 4 centimeters of volume at the distal end. Well, it's hard to manage that much volume loss with just socks alone. In his particular case, we added some pads within the socket. So if I show you the inside of the socket, what you'll see is the residual limb comes inside the socket and there's some gaps down in here where the residual limb sits into. So we'll take these pads. These are just Muscived pads that I have, firm cell foam. We'll slide it right down into there and kind of glue it right on the back of the socket, and that helps reduce the volume inside the socket. Well, there's a point where you can only put so many pads and you can only wear so many socks where it becomes uncomfortable, it's unmanageable, and you really have to do what we call a socket change. That's when we're going to recommend that you see your physician again. We're going to back up that recommendation with accurate measurements that we've taken since day one that your prosthesis was made, and we'll have to change this socket. So those are some of the strategies that you use to manage your residual limb to help get this socket stretched out long enough till you can get a socket change and keep you back on your feet. So thank you for tuning in. Appreciate y'all watching the video. This is Dave Ritchie, Ritchie Limb and Brace, New Braunfels, Texas, and Seguin, Texas. www.gotlimb.com.